Hello everyone, my name is Ismitara LMS and I am working as an assistant professor in the Department of Physiotherapy, University of Science and Technology, Meghalaya. So today we are going to discuss about electrocardiogram. So what is electrocardiogram? Electrocardiogram is basically a diagnostic tool. Okay, electrocardiogram is basically a diagnostic tool which will help us to measure the electrical activity and the muscular functions of our heart. Okay, so in electrocardiogram we use different kind of electrodes which is placed over on our the skin surface. Okay, skin area. So with that electrodes we can measure that electrodes measures the electrical activity of our heart, and it is indirectly provide the evidence of blood flow to our heart muscle. Okay, so now if we are talking about indications, so ECG is performed in the person who have heart defects. Okay, who have heart conditions like myocardial infarction, arrhythmia, any metabolic disorders like hypokalemia, etc., and endocrine conditions, hyperthyroidism, and most firstly with the patient who have diabetes. Okay, and apart from these conditions we use ECG prior to surgery. Prior to any surgery we should perform ECG to know about the condition, know about the status of our heart. Okay, so it is very important to perform the ECG along with other examinations, other investigations. Okay, so in ECG leads, okay, leads of ECG. So in ECG we have 12 leads. Okay, so those 12 leads are divided into two groups. One is limb leads and another one is chest precordial leads, and it is equally divided in 6. Okay, in limb leads there are 6 leads, in chest precordial leads there are also 6 leads. But to measure the electrical activity by those 12 lead ECG, we have only 10 electrodes. Okay, we have only 10 electrodes. So in limb leads we have 4 electrodes, in chest precordial leads 6 leads, we have 6 electrodes. Okay, so you can see the V1. No? V1 is placed right side of the sternum between the 4th and 5th rib. Okay, and the V2 will be in the same level, but in it will be in the left side, and V3 near the nipple. Okay, near the nipple over the 5th rib. It will not be placed on the intercostal space, but it will be placed on the rib, that is the 5th rib. Okay, so V4 will be placed 2 centimeter away from the V3. V3 was placed over where? On the 5th rib, no? And next V4 will be placed from that V3. It will be 2 centimeter away between the 5th and 6th rib. Okay, 5th and 6th rib, which is the 6th intercostal space. Okay, so V5 will be the electrode V5 will be placed over the 6th and 7th intercostal space, that is the 2 centimeter away from the V4. Okay, and the V6 will be on the axillary line. Okay, so limb leads we have 4 electrodes. One is left arm, one electrode will be placed over the left arm, left leg, left right arm, and right leg. Okay, so limb leads electrode will be should placed over the soft tissue area. Okay, soft tissue area, then the bony area. So it will be placed over the muscles of our arm, leg, and in the both right and left side. Okay, So these are the leads, limb leads and chest precordial leads. Okay. So now talk about the Einthoven's triangle. 12 lead ECG Einthoven's triangle. What is Einthoven's triangle? So Einthoven's triangle works on the principle where not only does right arm, left leg records the heart's electrical activity, but it will correspond with the FER, FEL, FEF. Those are what? Those are limb leads. Okay, so it will those 4 leads will help to measure the electrical activity of our heart, okay, by this Einthoven's triangle. So in Einthoven's triangle we have positive and negative electrodes. Okay, positive and negative electrodes. So first let's talk about the leads. The limb leads, we have lead 1, lead 2, lead 3, then FER, FEL and FEF. In lead 1, the electrode we have placed over the left arm will be the positive electrodes, okay, and the right arm will be the negative electrode. And in lead 2, left leg electrode will be the positive one and right arm electrode will be the negative one. Okay, in lead 3, left leg will be the positive one again and left arm will be the negative electrode again. Okay, let's see the FER. FER will be in which side? Right side. FER, right side. Right side. So that electrode placed over the right arm will be the positive electrode. FEL will be in which side? Left side. So the electrode placed over the left arm will be the positive electrodes again. Okay, and FEF will be the electrode placed over the left leg. That electrode will be the positive one, and the other 2 electrodes in every FER, FEL and FEF, the other 2 electrodes will work as the negative electrodes. So did you notice that right leg electrodes is not there in the triangle, in the Einthoven's triangle? So what will be the work of right leg, the electrode placed over the right leg? The work of right leg electrode is to reduce unwanted noises, and if there are some interference in electrical activity, the right leg electrode will reduce those interference. Okay, it will work as a grounding electrode. Done. So now talk about waves and segments of ECG. Okay, so I have mentioned before that ECG machine pick up signals from the electrode placed over our skin. So those electrodes, those electrical activity we will see by some graphical representation. Okay, so if you see any patient's ECG report, you will see some graphical representation on that report. Okay, so those graphical representation will help us to detect if there are any pathological conditions or the heart is working well or not. We can detect all those by those electrical activity. Okay, so if the electrical activity towards the leads, okay, we have leads. I have already mentioned the leads. So electrical activity towards the leads will be upward deflection. So those some electrical activity, some in the graphical representation, some electrical activity will be downward. Okay, will be downward. That is what that will indicate that the electrical activity is away from the lead. Okay, so in basic ECG interpretation, the normal ECG interpretation, there are three waves. Okay, three waves. First one is P wave. First one is P wave. Okay. Second one is QRS complex. In QRS complex, there are also three wave, that is Q, R, and S wave. All together, it calls QRS complex, a wave complex. Okay, and last one is T wave. In some condition, in some ECG reports, you can find an U wave. Okay, an U wave you can find. Okay, but in normal ECG, the basic ECG interpretation, there are only P, QRS complex, and T wave. Okay, next is, you can see this is the P wave. Okay, and this one is QRS complex, where QRS wave is there, and this one is T wave. And some as I have mentioned, that in some ECG report you can find U wave. So U wave will come after the T wave. Okay, after the T wave there will be some upward deflection, which will call as U wave. So in here you can see PR interval now. So what is PR interval now? So PR interval is the first deflection of P wave and the first deflection of QRS complex is called PR interval. So this is the normal ECG interpretation. Okay, so I have already mentioned the P wave. First comes P wave, and P wave is a small deflection wave. Okay, so small deflection of wave, it will represent what? It will represent arterial depolarization. Okay, it will represent arterial depolarization. So now what is arterial depolarization? What is arterial depolarization? It is the contraction of muscle, contraction of heart muscle. Okay, next one is PR interval. No, so you can see the PR interval is the time between the first deflection of P wave and the first deflection of QRS complex. So now talk about QRS complex. QRS complex. So QRS complex, there are three waves now, Q, R, and S. So here there is some confusion. There many times there some technician faces some confusion. Okay, so one of the most confusing aspect of ECG reading is the labeling of this QRS complex. Okay, so the rule is, if the wave immediately after P wave is an upward deflection, it is an R wave, and if it is a downward deflection, it is the Q wave. You can see after P wave, if it is an upward deflection, immediately after P wave, if there is upward deflection, it will be the R wave. And here you can see after P wave, immediately there is a downward deflection, so this wave is called Q wave. Okay, but if the Q wave would not present here, and if suppose there is Q wave is not present, and here an upward deflection is present, so that deflection will be called the R wave. Okay, so okay, done. So QRS complex, after QRS complex, ST segment. Okay, so ST segment, which is also known as ST interval, is the time between the end of the QRS complex and the start of the T wave. Okay, you can see ST segment, end of the S wave, end of the QRS complex, and start of the T wave. Okay, so in this ST segment, it is the period of zero potential between ventricular depolarization and ventricular repolarization. Okay, so when the ST QRS complex is ending, ventricular depolarization take place, and when the T wave is starting, here the ventricular repolarization takes place. Okay, you can see in T waves represent ventricular depolarization. Okay, ventricular repolarization. Okay, so there is arterial depolarization, then arterial ventricular repolarization. There is arterial repolarization also. Okay, but the arterial repolarization, the intensity and the wave intensity of that wave is not that big. It's not that bigger, so that the large QRS complex, it is obscured by the large QRS complex. Okay, so that's why we cannot see the arterial repolarization. Okay, these are all about ECG, the basic interpretation of ECG. Okay, we have already discussed the waves and segments. Okay, then the leads of ECG, there are 12 leads and 10 electrodes, and the Einthoven's triangle. The most important part of ECG is the Einthoven's triangle. Okay, so this is only the this is for today. We have discussed the ECG topic, all the waves, triangle, then segments we have discussed in this session. Okay, thank you.